Hi, I'm Aaron, and I'm not 18. I'm actually 23, so don't think I look too old. So I'm here to talk about healthcare. And basically, when we talk about healthcare, we often talk about these really big ideas and like, oh, look at this graph, look at this danger in 2036. Kind of want to bring it down to the very basic level. I'm going to talk through a recent physician visit I had and just do a cost breakout as I go through, so you see costs, increase. So this is the beast of healthcare. This is a basic physician visit that all of us have had. As you see, there's sort of a lot of stuff going on just to go see, one physician. So whenever we first determine, usually we need to go see a doctor. For me, it's whenever I get sick, because I'm young, I don't often need to go to the doctor. So being sick sucks, right? Because it's a huge hassle. It's like going to DMV. It's stuff that we have to do but really don't want to do. So called my doctor and I asked, can I have an appointment? And he said, oh yeah, in 2 weeks. I was like, oh great, yeah, I'll be sick for 2 weeks. That's fine. And but this isn't actually, unusual. On average, most people wait 1 to 2 months to actually see a doctor. This is for two reasons. One is patient demand, and another one is this whole behind the scenes that actually goes on that we don't know about. One of those is that the insurance company actually needs to verify who I am. And one of those is benefits, and other ones is, how long I've, been on the plan. And the thing is, the insurance company actually limits the number of time you can verify benefits to 3 per hour. So they kind of need a span of time to check this. So eventually, I got to go visit my doctor. I didn't spread my disease to anybody in 2 weeks, so that was a pretty good accomplishment. I drove to go see my doctor. He works at a big hospital. First thing I see, though, is not my doctor or nurse. It's actually this medical form that we all see. And we all have filled out several times, 300 times probably, at least for me. The only reason I know exactly what I'm allergic to, Levaquin and C-Chlor, is because I had to fill out Levaquin and C-Chlor more than 300 times. So hand this back to the administrator, and what I do again is then what we all do, which is we wait. I waited approximately probably 45 minutes. On average, there are half of physicians in the United States are late 30 or 60 minutes every single day. So I waited for 45 minutes, and the nurse came back out and said, hey, it's time to see your doctor. I said, hey, what's up? And the doctor rolled in, and he said, hey, Aaron, how's it going? And it's sort of like that awkward moment whenever you find someone on the street and says, hey, we're Facebook friends, and you're like, you don't know anything about me, but he talks like he does. And I tell him what's wrong, and he gives me a diagnosis. As most doctors said, let's do some more tests. And so he recommends an imaging scan, and he also recommends some lab work. And eventually, we talk for probably another 5 more minutes, and then he's quickly out the door. Most doctors only spend 15 minutes with their patients because once they see you, that's how they get paid. In healthcare, the way physicians actually get paid is actually have to see you face to face. So he quickly leaves, goes on to the next patient, and he rolls in his nurse, and his nurse will then guide me through the next process. So we walk down the hall and do my imaging scan. We walk down a couple more doorways, and she takes my blood and does the lab work. This is all in office because a physician actually pays much more if all these things are actually around his practice facility. So at the end, you go see the checkout lady, and guess what? Everything costs $25. Who wouldn't be excited about that, right? It's like the ultimate Groupon that no one's ever discovered. But the thing is that the most important part of healthcare is actually what happens when we don't know about. This is the real battle of healthcare. This is what the doctor wants to build an insurance company, and the insurance company does not want to give up with their life. So we pay $25, and the insurance company pays $348 according to my bill. So the first part of the battle is that the doctor has to code this and send it to the insurance company. And this is a throwback to the 1980s because this is how old this process is. They code in a specific numeric code for whatever they performed on me. They either write it down, or then they send it to, or they electronically fill it out, and then they send it to the insurance company. The insurance company then receives the bill, and they look over my own patient history. They look over what they have negotiated with the actual doctor. They look at his own practice history, look at a myriad of things, and then they sort of sit on the bill, and they debate whether or not they want to approve or deny. Luckily for me, it was something very average, so I was approved. I don't know if you ever have been in the space of denial in health insurance claims, but I do not recommend that. That is a space that no one wants to venture in because it is very dark and dangerous. So eventually, 2 months later, I received this bill in the mail. This is my actual bill. As you see, it is quite mysterious because it looks like it's written in another language. There are a lot of things on there. One is actually suggests whether or not they didn't even know if I paid the doctor. It says, you may owe $25. So in all, this is what the cost was. For me, it's $25. The doctor billed $348. It cost the doctor about $100 to perform all these specific procedures. The doctor got reimbursed $200, so about half off, and the total cost of insurance company is $220. Overall, what does this mean? If you expand this entire process to the entire United States, this was $200 billion in waste per year. So basically, what you should do with this information is actually be involved in your healthcare, because other people are making these decisions for you every single day. Thank you.